Zambia is a multi-stakeholder initiative made up of the Ministry of Health, medical stores, pharmaceutical regulatory authority, civil society organizations, and the private sector involved in the manufacture and supply of medicines. Livingstone was until 2012 the capital of the southern province of Zambia. Lying 473 kilometers from Lusaka and 10 kilometers to the north of the Zambezi River, it is a tourism center for the Victoria Falls and a border town with road and rail connections to Zimbabwe on the other side of the Victoria Falls. A historic British colonial city, its present population is estimated at 136,897 inhabitants as of 2010. It is named after David Livingstone, the British explorer who was the first European to explore the area. On the 27th of September 2013, Zambia traveled there to hold a procurement workshop. Those invited included procurement officers and pharmacists from Livingstone and surrounding areas.
So the hierarchy, the top, the government who are at the top should put up laws and regulations which must be followed, and if one doesn't follow, sanctions may be applied. So in good governance in medicine procurement, what are we saying? It's important to identify what you need. And when you identify what you need, you say it by name. If you want paracetamol, 500 milligrams, it is paracetamol, 500 milligrams. And when you go to procure, it is not for the person who is going to procure to just change anyhow, because you have been given a permission of what so much, it says no, just to change and just to get aspirin. And because perhaps, I don't know, as we are discussing, we have sent him who does not understand the difference so much between paracetamol and aspirin. He doesn't understand what is in stock. You have bulks, a lot of aspirin in stock. He has gone to procure, and then he's told, no, we don't have paracetamol, we can give you aspirin and it is much cheaper, so we'll give you, we'll cut down 1, 2, 3, 4, you buy at this much. He procures, you bring that aspirin. In stores in the pharmacy, there is aspirin which you can't count. I'll give you my experience again, Livingstone General Hospital. I was implementing logistics management, and I knew what I needed. And I wrote, making a request to the Permanent Secretary, Cabinet Office. But me, these things, I'm in trouble. That office, they communicated. And the answer that came was, there are so much drugs at medical stores, and the cameras went to medical stores. And the instructions were given, load, a truckload to Livingstone. And a statement was made on the media. And for sure, within 2 days, a truckload medical stores of pharmaceuticals arrived at Livingstone General Hospital. We spent the whole day of loading and counting. And the community, they saw that medical stores truck has done what? It has come. And it has done what? It has delivered. And the people came in good numbers. Those who had the prescription, out of stock, out of stock. Believe you me, what came was a lot of POP, which was not moving. So they loaded a lot of what? A lot of what? What we needed, the paracetamol, Septrin, what Peniv, what have you, nothing. I was the one facing the patients. The staff there says, Madam, we are in trouble here. The clients, they have refused, they saw the truckload. I went there. We are going to manhandle you. Give us the drugs. Why are you hiding? I said, no problem. Those who are willing, come. I walked them into the pharmacy, into the main pharmacy there. I said, here are the papers. Those who can read and can explain, please read. So they would read. We went through the invoices one by one, and they would read. What are you reading? I'm reading water. Water, yes. This is why I show you the water. This is the water. What are you reading? Sweets. These are the sweets. What are you reading? Paper. These are the paper. We went through the whole pharmacy, and then I said, now show me, where is the paracetamol? So what am I supposed to give you? And the story ended there. I wasn't woman-handled. And the next minute, I was invited to go to Lusaka, and I was told, according to her list, Director of Pharmaceutical Services, purchase. And I brought now a proper truckload of the correct things that I needed.
All they want is to make you look as if you don't know what you're doing, and then you have to blame for all the shortage. I'm not sure that thing is not there, and the problem starts high up there. So sometimes the problem comes from them, or even politicians. Politicians just say, no, the government spends so much billions on buying drugs, why are they not drugs? Then no one can explain why they're not drugs. So just come and blame the person on the ground there to say, they're the ones that are mismanaging the commodities. So it's like just an instance where no one seems not to take responsibility. That's what I'm saying, there's not this, there's that. So everyone is throwing the blame on the other. No one is willing to accept that actually here I'm responsible. I think that's what would cause that misunderstanding what you just mentioned.
So that's why the definitions we're looking at is participatory. So whoever goes to procure should be within what the stakeholders, all those who sat with on the table, they discussed. And if anything, there's no harm in consulting.
Now the objectives is to present the MOH medicines budget. We are not preview. We hear about these budgets, but do we really go down to look at the nitty-gritties of the budget? And to describe the procurement cycle for essential medicines, to present an overview of MOH procurement system. And in the introduction, we have pharmaceutical procurement system is major determinant of availability and total health costs. And then GRZ medicines budget is 590 million per capita, 18.4% of total GRZ health budget. The other objective is to increase availability and accessibility to all essential medicines and medical supplies in all health facilities. I think this is in line with our current government manifesto. The Pharmaceutical Services Unit, this is under the Director of, what is that? Which department do we fall in? Director of Clinical Care and Diagnostics. Okay? So National Essential Medicines Budget 2013 is a key strength here. We have 112% increase in the drug budget from 270 billion in 2012 to 594 billion.
My emphasis would be to look at why do citizens matter from our professional point of view. What is it that can bind us towards citizens? Now, I want first of all to define that if you read the Zambian constitution, at the beginning it says we have chosen to be a democratic country, we have chosen to be accountable. That is one of the key fundamental principles that is embedded in our constitution. Then we have said we are going to choose a democratic governance of style, where we are going to come up with representatives for ourselves. So it simply means that citizens, every citizen potentially is an MP. Every citizen is a president. But we know that all of us, 13 million, we can't go to State House. Not so. So we choose somebody on our behalf to represent us. We choose also a few people, 150, to represent us. But which simply means we are part and parcel of those people. So when it comes to those concepts, we need to define them and make them practical. I talked of governance. Governance simply refers to the power relations between the governed and the governors. So those we choose to represent us, they are governors. Those of us who are just following where they lead, we are governed. And then there's what we call democracy, a government of the people, by the people, for the people. It's basically the same, that you put in place people on behalf of people, and this whole thing is driven not by animals, but by fellow human beings who are people. So we expect those people to be accountable. Accountability simply means the power, the constraints that are placed around us to regulate our behavior. Then transparency means clearness, the rules are clear, and so on and so forth. So from family level, even at a higher level, it can happen. People can peel for drugs, do funny things. Not so. That is lack of accountability from a lower level up to a higher level. So citizens actually expect that ourselves, in our various portfolios, we should be able to be accountable, for the simple reason that we have been entrusted with power and authority on behalf of the citizens. The citizens empower two types of people with that responsibility. The first one are what we define as elected officials, like these politicians. Not so. Those are in the category of elected officials. Then the second category is, which is the other category, elected officials. The second one is ourselves, appointed officials. We are also appointed by the state to run the affairs of the nation. And citizens, of course, expect us to abide by those particular regulations. And in conclusion, I want to end by indicating that this is why there are various stakeholders, like what we are doing today, to try and encourage you not to betray citizens, but by stick to the rules of the game, because the citizens' expectations are quite high. And the mere fact that we are sharing today is just to uplift those particular standards.
Meta Zambia is a multi-stakeholder initiative made up of the Ministry of Health, medical stores, Pharmaceutical Regulatory Authority, civil society organizations, and the private sector involved in the manufacture and supply of medicines.